except everyone from science side. It's good anyway. In my experience, I just would like to share a few things for the past 30 years. என்னுடைய 30 வருட அனுபவம் தொலைக்காட்சி உலக அளவில் அதிகமான medical entries done by me world level in Tamil only by me, I guess. It's all. I have identified a few things on this. இரண்டு விஷயங்கள் தெரிஞ்சதுல ஒன்று, the creamy layer people பணம் வச்சிருக்காங்க வசதி usually what they do is for kind of surgeries like transplant, neuro or brain surgeries, they go abroad. நாங்க அமெரிக்கால சர்ஜரி பண்ணோம், ஆப்ரிக்கால பண்ணோம், இது பண்ணோம், கேட்டு நிறைய பார்த்தோம். இந்தியன் ஆப்தல்மாலஜியை தாண்டி ஒருத்தர் ஆப்தல்மாலஜி ட்ரீட்மெண்ட்டுக்காக நாங்க இந்தியா விட்டு வெளிநாடு போனோம்னு சொல்ற ஹிஸ்டரியே இல்லை. That's a success of Indian ophthalmology. Nobody traveled for ophthalmology treatment out of India. This is very, very rare. Down the line. காலையில யூடியூப் திறந்தோம்னா வயிறு பெருசா இருக்கா, இதெல்லாம் கலந்துக்கிட்டீங்க சரியா போயிடும். அப்புறம் கண்ணு சரியா தெரியல, இதெல்லாம் கலந்துக்கிட்டீங்க சரியா போயிடும். நிறைய சொல்றதை பார்க்கலாம். ஆனால் யாருமே ஒரே ஒரு விஷயத்துல மாத்திரம் அதில் பார்த்தீங்கன்னா, சாரி கண்ணுன்னு சொல்லிட்டு கண்ணுக்கு மாத்திரம் அந்த மருந்தே சொல்ல மாட்டாங்க. நீங்க வீடியோல நிறைய பார்த்திருப்பீங்க இந்த யூடியூப்ல. You have to listen many things. Okay, you do this, you do this, you do this. Right surgery எல்லாம் பண்ண வேண்டாம். You don't go for this, you don't go for that. But for ophthalmology treatment, there is no one can have essential things. This is one of the best. Third thing, our doctors used to go for practice in Budapest and many countries for kind of updations on the level of treatments. But as for ophthalmology is concerned, other country doctors used to visit to India and get the treatment. These are all the three observations which I noticed in my career. I always used to say the ophthalmologists are the educators, they are not only doctors. 10 வருஷத்துக்கு முன்னால ரெண்டு விஷயங்கள் பெருசா கவனிக்கப்படாம அலட்சியப்படுத்தி இருந்தது. ஒன்று ophthalmology, இன்னொன்று sexology. These two domains in the medical field was not taken serious about 10 years back. Today, it's the very highest domains in medical history. People are concentrating more. இது ஒரு மிகப்பெரிய வெற்றி. Always these doctors, I notice, they educate a lot, especially the ophthalmologists. அவங்க ட்ரீட் பண்றது 5 minutes செக் பண்றது 10 minutes எடுத்துக்கிட்டு நம்ம வச்சு அவங்க பேசுறது குழந்தைகிட்ட ஆரம்பிச்சு எல்லாத்தையும் கண்ணை எப்படி மூடணும், கண்ணை எப்படி திறக்கணும், இப்படி இருக்கணும் அப்படின்னு. So ophthalmologists are the best educators in the world, according to me. My salute to everyone who are here, and thank you very much for all the guests in the days, and my friends, and again, my educators. Thanks for this opportunity. I share.
Thank you so much, sir. As you mentioned earlier, he often leaves the doctors astounded with who is leading the discussion. He proved it once again. Thank you so much.
We want to do our part to share our knowledge, to get the stalwarts of Retina involved in sharing their knowledge and getting the youngsters excited in Retina. Now, we have so many postgraduate students who are in ophthalmology. If even 10% of these get excited about Retina and come into Retina, it will be a big boon for the country. But that being said, we are very, very proud to have this conference here today, and so many of you have registered and shown interest. We will keep this going, and I will now invite Dr. Lalit Verma to come and share a few words.
Nearly 100 yesterday, and that speaks volumes of its popularity. And hosting Reticon is a very, very big occasion. Must congratulate the Agarwal group of hospitals for doing year after year a conference dedicated to advancements in exclusive. That's a rare. And 6 sessions covering all the hot topics in Retina, including the case presentations, debates, review sessions, and anything that is not leaving behind the AI, gene therapy, and stem cell therapy. And hats off to Nadu for meticulousness in her crafting this program. Also, including who's doing the Retina in this 9 to 5 one-day event. And also, my thanks are due to Mr. Kumar Guru and Mr. Harish for arranging all the logistics and being very, very prompt in responding. Congratulations to one and all. Thank you, sir.
Government Ophthalmic Hospital and the Radio Institute of Ophthalmology. What a beautiful project, centenary building, the most modern state zone. I'm very proud of being product of the government of hospital and also part of Sangumani. So we from Agarwals will also extend our public-private partnership and do something for teaching young people, as Dr. Ashar said. We have in diabetics populated by Dr. Mohan, and 58% of them do not know they have diabetes. That means 5.8 crore people do not know they have diabetes and they are in the country. And then there is a possibility some of them may go blind. So that's our mission. And I also head the Delhi Ophthalmic Society of India, where we can connect to Ashar to Kanyakumari and from Arunachal Pradesh to Kutch. The idea is we should empower people without the ophthalmologist and optometrist to do diabetic screening. So only the people who need treatment will have to come to the hospitals. And we have 170 hospitals, but we, as Ashar said, we have 28,000 ophthalmologists registered. Among them, about 2,000 are members of the Vitreo Society. Fortunately, in Retina, we have now surgical Retina and medical Retina. And even though I'm an aggressive vitreoretinal surgeon, I am now into the community of ophthalmology and public health ophthalmology to screen. As the president, we made a program called Stop Blindness, screening through daily ophthalmology to prevent diabetic blindness. And I think we should be the leaders, and we are using offline AI in the mobile phone, attached to a correct device, and we don't need any. So I call them as ABCD. Anybody can use for screening for diabetic retinopathy. So we use this camera in the motorbike and go to the small places, including all the slums of Mumbai, and now we want to reach every village in India. We only have 6,47,745 villages. That's my dream. So with this, I think every citizen deserves eye care. And as Ashar said, there are few people, patients, we have the word Vitreous, and all the flashes and under what the wash in the toilet, we have only one word Vitreous. And we are specializing Vitreous in Retina diseases, which if the Retina doesn't work, what about this? So that level is important. And part of this whole decade, my 40 years doing treatment surgery. With this, I wish everybody gets examined whether they are normal or they are diabetic. And with this, thank the Agarwal group for having me here. Thank you.
I wish all the best to the 14th annual conference of this Reticon. Eye is a very important part of the body, after all we know. Not only eye, in the eye, the retina is the important part of the body. See, you know, eye is the highly expressive organ that has. You can transmit or conduct any feeling of the human being through the eyes. That kind of sensation will not be there in animals. So eye is a very sophisticated and complicated organ. So I wish this regional conference should be successful, and everybody who is coming all over state, all over India should come to the hospital, come to the conference and enrich the knowledge. Because continuing medical education is very, very important in the sector, especially medical sector. That is very important.
The patient doesn't understand it because externally the eye may look normal. So the regular checkup panno. So every patient should have regular checkup done. Then only we can find out the diseases of the diabetes which can affect retina. In fact, under the Agarwal group of hospitals, we are doing regular diabetic retinopathy screening. So just like we do screening for the glasses and everything, we now have special cameras where without any special gadgets, we can take photograph of the retina. We can check whether diabetic retinopathy is there or not, because by the time the patient will know, permanent damage to retina will have happened and we will not be able to improve the vision of the patient. So it is very important that this awareness is there amongst all people, that patients should also know, the doctors should know, more and more doctors know it. Here that we do the teaching of not only the patients but the doctors, that how the retina should be examined and treatment should be done well on time to prevent blindness.
Actually,
Medical treatment also can be done, laser can be done, injections can be given, but some situations, serious and complicated surgeries will be required. So here we have covered all the aspects, how to do even complicated surgeries, but taught here on a video-based session, and by the very famous and authentic doctors of the country. Best of doctors came. Almost 40 doctors came from across the country in this conference, and it was physically attended by more than 600 to 700 delegates who were here to see the meeting and learn from all these videos and their experience, which is some of the doctors had more than 40 years of experience in this line.
What is that is Dr. Agarwal Eye Hospital is the number one in tackling the surgery of the retinal surgery among that all other hospitals.
We have the best of doctors available who can do any kind of surgery for the retina which may be required for any patient.
Is retina clinical test is affordable?
Yes, sir. It can be done by a simple examination and no extra gadgets or anything is required. We can put drops and dilate the pupil. And in fact, they say the eye is like a window to the whole of the body. This is one place in the body of humans where we can actually see the blood vessels, where we can see live as to what is happening. Like we will say, heart patient solvanga, the blood vessel block aiche. The heartless park mudiyada. Indirectly, angioplasty and all those things we will do. But here in the retina, if we know how to examine, we can actually see these blood vessels and treat them very effectively.